All right, next up we have the Craig's test. Craig's test is to assess for femoral anteversion. And so if you're suspecting that your patient has a bony morphology variation that might have them toe in, this is important to understand for squatting mechanics and other things, as well as people with hip dysplasia and things like that. We want to make sure that we're understanding their bony anatomy as well as we can. So one of the ways we can test for this is something called the Craig's test. So what you're going to do is you're going to, with your thumb, you're going to palpate the person's greater trochanter on their hip. So I have the greater trochanter. Let me see if I can find it here right here. Greater trochanter is right here. So then what we do is we flex up one knee, the hip that we're trying to assess, and then you're going to internally and externally rotate the hip until that greater trochanter is pointed directly lateral to the best of your palpation skills. So what we do is we rotate the hip back and forth a few times, and what you're going to feel as you're palpating there is you're going to feel the greater trochanter under your thumb sliding underneath of it. And so again, you're just going to keep going until it points laterally. I think that'd be at this point for this individual. So we're going to ask them then try to hold their leg there, and you can stabilize it with your hand if needed. You're then going to have your goniometer handy, and you're going to come in and try to measure their amount of internal rotation compared to vertical. So this individual has pretty neutral, about 4 degrees here of motion, and which we can say he does not have an anteverted hip. You do this on both sides, obviously. A hip that has 15 degrees or more, we consider to have femoral anteversion. Anteversion is the inward rotation or inward twist of the femur, and these patients might present with a toe-in gait pattern, whereas retroversion, excessive retroversion, might have that classic duck walking outward foot pointed position. So this is how you would test to see if their bony anatomy is the contributory factor to maybe gait patterns or squatting patterns.